Bustling streets, vibrant markets, and the hum of life finally feeling normal. We thought we'd left the dark days of the pandemic behind. Families were reuniting, businesses were thriving, and travel was back in full swing. But then, like a storm cloud on a clear day, COVID-19 roared back, sweeping across Asia and hitting countries like Thailand, Hong Kong, Taiwan, and Singapore hard, with warning signs in other regions like Europe and Africa. It's not just a few cases. It's a wake-up call, a reminder that this virus doesn't quit, and neither can we. Let's dive into what's happening, why it matters, and how we can fight back together. Since early May 2025, countries across Asia, including Thailand, Hong Kong, Taiwan, and Singapore, have been grappling with a troubling surge in COVID-19 cases. We're talking thousands of new infections daily in the region, numbers we haven't seen in years. The culprit? A new variant called XBB.1.16, nicknamed Arcturus by scientists. It's sneaky, highly transmissible, and spreading faster than its predecessors. Hospitals are feeling the strain. In Thailand, over 5,000 people were admitted last week. Hong Kong reports a spike in severe cases, with deaths rising from 3 to 26 in a month. Singapore and Taiwan are seeing increased hospitalizations too. While most cases are mild, think fever, cough, or fatigue, some hit hard, especially for the elderly and those with health conditions. Dr. Somchai, a leading infectious disease expert in Thailand, explains, "This variant evades immunity better than older strains. Even if you've been vaccinated or had COVID before, you're not bulletproof." This isn't just Asia's story. It's a warning that the virus could spread further if we don't act. So, how did we get here? Experts across Asia point to a perfect storm of factors. First, let's talk masks, or the lack of them. After years of restrictions, people got tired. Masks came off and crowds got cozy. Markets, festivals, and public transit in cities like Bangkok, Hong Kong, and Singapore became hotspots for the virus to spread. Then there's travel. Asia's a global tourism hub, welcoming millions of visitors each year. With borders wide open, the virus hitched a ride. Airports, hotels, and tourist spots across the region became unintended gateways for XBB.1.16. And here's the kicker. Our immunity's not what it used to be. Vaccines and prior infections gave us a shield, but that protection fades over time. Without boosters, our bodies are less ready to fight back. Dr. Somchai puts it bluntly, our community immunity is like a leaky bucket. It needs constant refilling. Add to that the virus's own tricks. XBB.1.16 is a master of disguise, dodging antibodies like a pro. It's not that we failed, it's that we got comfortable. And COVID loves complacency. This surge isn't just numbers on a chart. It's real people, real struggles. Take Ratana, a 40-year-old teacher in Bangkok. "I got all 3 shots," she says, "but last week I tested positive. Now my husband and 2 kids are sick too. We're exhausted, and I'm worried about my students." Ratana's story is echoed across Asia. In Hong Kong, small business owners lament fewer customers. In Singapore, schools struggle with low attendance as parents keep kids home. Street vendors in Taiwan face similar fears of losing their livelihoods. Schools are in chaos. Some have gone virtual, others are half empty. Families are postponing plans, vacations, birthdays, even hospital visits for other health issues. Yet, there's resilience. Communities are rallying. Volunteers in Thailand deliver food to quarantined families, and local leaders in Singapore spread awareness. It's a reminder that even in tough times, people find ways to shine. While Asia is the epicenter of this new COVID-19 surge, the world is watching closely. In Europe, the situation varies. The Netherlands reports low SARS-CoV-2 levels in early May 2025, but Eastern and Southwest Europe saw case increases in April, per the World Health Organization. In the United States, most states report declining or stable cases as of May 6, 2025, with only one state showing growth according to the CDC. Meanwhile, Western Africa and Central America have reported elevated activity recently. This global patchwork shows the virus is still a threat. International cooperation is key to keeping it in check. Why is this surge happening? The answer lies in the science of XBB.1.16, or Arcturus, an Omicron subvariant. Its mutations make it highly transmissible and able to evade immunity from past infections or vaccines. Virologists note XBB.1.16's spike protein changes allow it to bind better to cells and dodge antibodies. It's also linked to a unique symptom, pink eye, which could aid early detection. Scientists are racing to study this variant and develop updated vaccines. It's a tough fight, but science is our ally. All right, here's the deal. We can't wish this away, but we can fight back. This isn't about panic. It's about taking control with steps that are simple, proven, and powerful. Let's break it down. Wear a mask in crowded places, markets, malls, buses, concerts. Anywhere people are packed in, a mask is your shield. It's not just for you, it's for the grandma next to you, the kid across the aisle. Studies show masks cut transmission by up to 70%. That's huge. Wash your hands like your life depends on it. Soap and water for 20 seconds. Hum "Happy Birthday" twice if you need a timer. It's not glamorous, but it stops the virus cold. Make it a ritual. After shopping, before meals, every time you're out. Get a booster shot if you're eligible. Vaccines are still our MVP. They slash the risk of severe illness and keep hospitals from overflowing. Not sure if you need one? Check with your doctor or local health center. Many Asian countries are rolling out free boosters for high-risk groups. Take advantage. Feeling sick? Test and isolate. Cough, fever, sore throat, or just off. Grab a rapid test. They're cheap and quick. If it's positive, stay home. Follow local guidelines, usually 5 to 7 days of isolation. It's not fun, but it keeps your community safe. But it's more than just actions, it's mindset. Think of every mask, every test, every shot as a brick in a wall protecting your town. Look at what happened in 2020. When we worked together, we flattened the curve. We can do it again. Imagine the impact. Fewer sick kids, thriving businesses, and families celebrating without fear. That's the future we're building, starting right now.